Hello, everyone. I'm Megan McGurman.
And I'm Jason Tokarski. Welcome to another episode of For the Love of Health, brought to you by ChristianaCare.
ChristianaCare's Delaware Medicaid Partners Accountable Care Organization, also known as an ACO, has set the standard for innovative, high-quality care at lower costs.
This value-based care is changing the lives of Delaware's Medicaid population. Joining us today are Dr. Christine Donohue-Henry, ChristianaCare's Chief Population Health Officer, and Dr. Rose Kakoza, Senior Medical Director for ChristianaCare's Medicaid ACO.
Chris and Rose, thank you both so much for being here today.
Thank you for having us.
It's great to be here.
As we mentioned in the introduction, ChristianaCare is setting the standard for quality care at lower cost. How are you doing that?
Well, it's through a focus on population health. We are absolutely committed to that as our strategy. And what that means is accountability for the health, well-being, and total cost of care of all the populations we serve. So that makes us do things differently. That makes us care for patients differently. It makes us accountable for those folks being healthy and staying out of the hospital and overall driving down costs.
One of the things that I like to point out is that when we're talking about population health, particularly in Medicaid, we're really talking about shifting our focus from treating illnesses to preventing disease. And that allows us, as Chris mentioned, the opportunity to really think about how we deliver care differently to drive health and wellness in the communities that we serve.
Chris, you joined us on the podcast back in the spring with our CFO, Rob McMurray, to talk about the cost of care, and you specifically mentioned risk. How do we continue to take on risk in connection with population health?
So we may have talked in our last podcast about risk models for value-based care. And in those models, you have a population of patients where you look at your historic costs to care for that population. And going forward each year, if you're able to decrease those costs and meet your quality measures, then whatever that savings is shared between the health insurance provider and ChristianaCare. But the converse is also true, where if costs are increased, that's called a shared loss. And in that case, ChristianaCare would pay back the insurance company. So by taking on that downside risk, as we call it, really puts your money where your mouth is, right? It really inspires you to make sure that you're making the investments up front to keep populations healthy in order to keep those patients out of the hospital, decrease total cost of care.
As a primary care physician, one of the things I love about this work is the focus on prevention, as I mentioned. So we've made some key investments, and I'll describe three areas that I think are particularly mentionable. The first is focusing on wellness. So we have had over 50 wellness days in our primary care practices. And at these events, we partner with our Medicaid managed care organizations, Highmark Health Options and AmeriHealth Caritas. And we have fun gifts and prizes for patients that come in. And the themes are really focused around specific preventative care opportunities, like breast cancer screening, for example. So these have been a hit with our patients and our providers. The second area is maternity care. So over 40% of deliveries that happen in Delaware are for moms on Medicaid. We knew that we needed to focus in on maternal care in particular. And so we made investments in expanding our nurse care managers focused on maternity, and they support our new moms and baby throughout the first year of life, a really critical time period. And the third area is around our pediatric population. So we have made investments in expanding our school-based health centers from high schools to middle schools and elementary schools. And in those venues, we're able to focus not just addressing the acute or urgent needs that students have in the schools, but also really driving immunizations and making sure that kids are able to get their preventative care needs met in the comfort of their schools. And mom and dad don't have to worry about taking off to take them in for an appointment, but we can really take care of the whole child's needs in the school.
And you probably have heard us talk before about CareVio, which is our care management program. So CareVio has nurses, social workers, physicians, pharmacy, and community health workers that are all unique staff positions that were hired specifically to address our Medicaid patient population. And they work very closely with our primary care docs in the practices, as well as the specialty clinicians that care for our patients.
All this preventative care seems like it's going to, in the long run, really help rein in the costs of dealing with somebody in the heat of the moment of an issue. What kind of savings are we talking about that we've accomplished here with this preventative care?
So with our Medicaid ACO in 2023, we have a $6.1 million savings.
And I think even above and beyond that, the most important thing is we've increased quality while generating those savings. So we've seen quality scores and our rates of adherence to preventative care increase by almost 10%.
So that is certainly a significant amount of money. The quality is improving. Have you heard from patients that they're feeling this as well?
Absolutely. There's one story in particular that I think is really powerful and important to share and kind of represents the work that we're doing and the importance of moving in this direction. So there's a young woman, 21-year-old, pregnant with her third child, and she was a very high-risk pregnancy. She actually had a cardiac arrest during her first pregnancy and had very high-risk medical needs. And she was unhoused, living in a motel with her husband and her two young children, both under the age of 2. But through some of the programs and support services that we offer, she had a maternity case manager working with her very closely to make sure that she was engaged with her prenatal care. She had a community health worker who helped address things like food insecurity, which you can imagine are critically important, particularly in a high-risk pregnancy. And she was able to successfully deliver a healthy baby boy at term with the support of her clinical care team, her case manager, and her community health worker. And even now, I mentioned earlier that the program sort of covers mom and baby through the first year of life. They've helped her secure employment. And that story is just one patient out of the 30,000 that we care for in our Medicaid ACO. And as we grow our primary care workforce, we hope that number will continue to grow.
And I'll point out that a lot of health systems across the country do value-based care. Mm-hmm. They focus those programs on their employees, which we do as well, and on commercial contracts, perhaps Medicare ACO. But what we believe at ChristianaCare is that if we're really going to care for our community, we also need to focus on our Medicaid patients in a much more meaningful way that really comes through value-based care.
Clearly, the patient that you were referring to in that story had a lot of different social drivers of health happening there in her story. Chris, if we're talking about 30,000 people and hoping to grow that, how do we stay on top of all those different drivers and making sure that each one gets the kind of care that they need?
Well, I will say it's challenging for sure. When we think about our Medicaid population, there's certainly many social factors that play a role, as well as behavioral health diagnoses. And the traditional model of care that's really built upon a fee-for-service payment model for visits in the office really doesn't work as well as the more innovative models that we're trying to build here at ChristianaCare. So those models include community health workers, as we've mentioned before, that work with patients, that explore what challenges they have in their own lives that can be addressed through partnerships that we have in our community, and utilizing what we call the Unite Us platform, which is a social needs IT platform that connects ChristianaCare and other community-based organizations.
And one thing I'll say is that because we've made these investments in community health workers, social workers, case managers, we're able to screen consistently. Part of the challenge for many systems is that you're not really screening for social drivers of health because you don't have a solution or a program to refer patients to. But because we've made these investments, we're now able to and do screen our primary care patients regularly at their visits for social drivers of health.
At Christiana, we have a community investment fund that is a fund with real dollars that are granted to community partners who are able to meet the needs of our patients around housing, food insecurity, transportation, and other challenges that they have.
Chris, you mentioned the Community Investment Fund, $1.6 million invested back into the community this year by ChristianaCare. Some may say, you're saving that money, keep it. Why is it important that we're putting that right back into the community?
Absolutely, because our focus is making our community healthier. And we know that we provide high quality healthcare. We are experts in healthcare delivery, but we are not necessarily experts in housing or in food insecurity and other areas. So having that community benefit fund allows us to really direct those dollars to organizations who are doing it well and meeting our patients' needs and continue to grow that support network that we need.
And I think what Chris mentioned is so important because as people think about ways and opportunities to optimize Medicaid and the way that we deliver care, what Chris is talking about shows that it's really through strategic investments where we can see the return on specific investments in terms of the health and wellness of the populations that we care for. One of the things that we're really focused on is as we see improvements in our quality performance, we really want to ensure that those improvements are experienced equally across all of the populations that we serve. And this work in particular allows us to look at our data and make sure that we're making the necessary investments that we need to support the various different populations that we serve in the ways that they need to achieve optimal health and wellness.
And we have goals as an organization to eliminate health disparities. And we are focused on breast cancer and hypertension control in particular. And those align very closely with the work that we're doing in our Medicaid ACO.
This is such a wide-reaching effort that we're making here. It's not just us. It's working with the community. It's working with partners. It's working with organizations that are out there. What is the message you would like to convey to the ChristianaCare community about the work that we're doing?
We are really proud of this work, and we believe that this work very closely aligns with our mission as an organization to really focus on equitable care for our neighbors. And we are doing that every day with the Medicaid ACO.
Absolutely. And I will just sort of underscore Chris's comments to say that this work, population health, particularly for our Medicaid population, allows us to really improve the way that we're delivering our care and to do so with love and excellence.
Chris and Rose, thank you both so much for your time today.
Thank you.
We'll have more information on ChristianaCare's population health initiatives, as well as a link to the Medicaid Accountable Care Organization in the show notes for this episode.
And don't forget, you can always connect with us on social media. Just search ChristianaCare on your favorite platform.
We'll be back in 2 weeks with another great conversation.
Until then, thanks for joining us for the love of health.